I want to take a few minutes today to talk to you about something I see walk through my door every single week. Sometimes it walks in as a 19-year-old who thought he was taking a pain pill at a party. Sometimes it's a 45-year-old mother who started on a prescription after back surgery. Sometimes it doesn't walk in at all. It arrives by ambulance, unconscious with a respiratory rate of 4 breaths per minute. I'm talking about drugs. And I need you to understand what they actually do to the human body, because the information most people have is either incomplete or dangerously wrong. Let's start with the brain, because that is where every addiction begins. Your brain has a reward system. It releases a chemical called dopamine when you do something your body considers good, eating a meal, finishing a run, hugging someone you love. That dopamine hit is a signal. It says, "Do that again." It is the biological engine behind every habit you have ever formed. Now here is what drugs do. They don't gently nudge that system. They hijack it. A drug like methamphetamine floods your brain with dopamine at levels 5 to 10 times higher than anything a natural experience can produce. Heroin, fentanyl, cocaine, they do the same thing through different mechanisms. The result is the same. Your brain's reward system gets recalibrated around the drug. Normal pleasures, food, connection, sunlight stop registering. The only thing that feels real is the next dose, and then the brain adapts. This is the part nobody talks about enough. After repeated exposure, your brain actually reduces its own dopamine receptors. It literally dismantles part of its own reward circuitry trying to compensate. What this means clinically is that the person is no longer using to feel good. They are using to feel normal, to feel anything. The withdrawal, the anxiety, the pain, the insomnia, the nausea, the feeling that your skin is crawling off your bones, that is your brain screaming for the only chemical signal it now recognizes. This is not weakness. This is neuroscience. This is a chronic, relapsing brain disease, which is exactly how the American Society of Addiction Medicine classifies it. Now I need to tell you about fentanyl specifically because it has changed everything. Fentanyl is a synthetic opioid that is 50 to 100 times more potent than morphine. It was designed for end-stage cancer pain, to be used in a hospital under controlled conditions in carefully measured micrograms. Today, it is being pressed into counterfeit pills that look exactly like Xanax, Adderall, or Percocet. I'm not exaggerating when I say a lethal dose of fentanyl is invisible to the naked eye. We lost over 107,000 Americans to overdose in a single year, and fentanyl was involved in the majority of those deaths. Young people are dying because they took what they thought was a single anxiety pill at a friend's house. One pill. That is where we are. What does an opioid overdose look like? I want you to know this because you may one day need to act on it. The person becomes unresponsive. Their breathing slows, 4 breaths a minute, then 2, then nothing. Their lips turn blue. Their pupils contract to pinpoints. That is opioid toxidrome, and without intervention, the brain is without oxygen within minutes. There is a medication called Naloxone, you may know it as Narcan, that reverses this. It is a nasal spray. It is available over the counter at any pharmacy in the United States right now without a prescription for about $20. It saves lives in under 5 minutes. Every household in America should have one. I'm not being dramatic. I'm being a physician. Here is what I also need you to hear. Addiction does not look the way movies taught you it looks. My patients with substance use disorders are engineers, teachers, veterans, teenagers, grandparents. The majority started with a legitimate prescription. The opioid epidemic did not begin in back alleys, it began in exam rooms, with pharmaceutical companies that told doctors OxyContin was not addictive, and doctors who believed them and patients who trusted their doctors. This was a systemic failure, and the people paying for it are still paying for it with their lives. If you or someone you love is struggling, I need you to know that treatment works. Medication-assisted treatment with buprenorphine or methadone reduces overdose mortality by more than 50%. Behavioral therapy works. Recovery is real and it is achievable, but only if we stop treating this like a character flaw and start treating it like what it is, a medical condition that deserves medical care. I am not telling you any of this to frighten you. I am telling you because you deserve accurate information and because the silence around this topic is costing us people we love. The conversation we are having right now, this is the conversation that saves lives. Please have it with your family. Please have it with your kids. And if you need help, walk into my office, call SAMHSA at 1-800-624-357 or go to your nearest emergency room. We are not here to judge you. We are here to help you.